Hello, this is Rashi Sahai, and you're watching Medicircle. Today, on our Children's Health Awareness series, we have Dr. Anand Bhatia with us. Dr. Anand Bhatia is a pediatrician in Delhi and is currently practicing in child and adult care clinic. For the past 9 years, he has worked as a pediatrician. Welcome to Medicircle, Dr. Anand Bhatia.
Hello, ma'am. Thank you so much for inviting me on this beautiful platform, and thank you. Thank you so much.
So, reportedly, India has recorded a significant decline in children under 3 years of age who have been breastfeeded within 1 hour of birth. So, according to the National Family Health Survey, 5 among the 22 states, like Sikkim, has reported the sharpest decline of 33.5% initiating breastfeeding within an hour of birth. So, doctor, can you please tell us, why is breastfeeding more important in child?
Yeah, sure. I mean, yeah, that's actually a very important topic regarding the breastfeeding because breastfeeding is so important. The first immunization of the baby, like breastfeeding, has so much of high nutritive value. As far as the breastfeeding is concerned, it has the most ideal constituent. It is for the baby because it has the best calories and the protein content as far as the baby's nutrition is concerned, because if you talk about the cow's milk, buffalo's milk, there are so many others type of milk, but breast milk is one which has the best protein and the calories and the sodium and potassium which is required for the baby. So as far as the pediatrician is concerned, it is our duty to stress all the to emphasize this breastfeeding to all the mothers, that this is really important for the mother as well as for the baby. So it is the best meal for the baby, as we say.
Okay, doctor. So, can you tell us, what are the common breastfeeding mistakes and how can one avoid them?
Yeah, exactly. So the common breastfeeding mistakes we have is like, most importantly, most of the women in India, they don't know the importance of the breast milk. They don't know the importance of the feeding, because we have a lot of tiny, labor room patients. They say, the doctor, I don't think so. My feed will be sufficient for the baby. There's a small myth because the mother says that, my grandmother says that, there's something known as janam gutti or something known as honey, jaggery, sugar, that is important for the baby. Doctor, my feed is not won't be adequate. Can you suggest him something else? So the half the problem is there only, that mother don't even realize that their feeding is the most important feeding which is required for the baby. Number one. Number two, the problem which the mother is facing, which we have seen in various communities and scenarios, there's a small, again, another second myth, that the mother should not eat anything after 7 days or 10 days of pregnancy. I have seen people coming on my follow-up in my OPDs saying that this mother, she's not taking chapati, she's not taking cereals, she's not taking fruits and vegetables because doctor has told beginning 10 days you don't eat anything and this and that. That also another breastfeeding problem, because if you don't eat a good food or a good meal, there won't be a good milk production, right? So, and that won't be sufficient for the baby. So number one, the first problem is, number one, you need to realize your milk is the most ideal milk God has made for the baby. There is no other substitute other than the breast milk. Breast, like we always say, exclusive breastfeeding. That is nothing but only and the only mothers feed in the beginning 6 months of life. So first thing, you need to know your milk is the best and your milk is the only ideal thing required for the baby. And second most important, as I said, that mother's diet is very important. We have seen a lot of mothers who have a very lack of good diet, good proteinaceous diet, and they have indirectly milk production issues, and they end up giving a cow's or a buffalo milk to the baby. So there are multiple issues actually, but these one or two are the common ones which we see in the mother: the lack of the confidence and the lack of the proper knowledge and awareness regarding the feeding.
Yes, doctor. So, can you please tell us, how long does the child carry their mother's immunity?
Yeah, so see, as far as immunities are concerned, there are a lot of vaccines actually. For example, if I talk about measles vaccines, there is something known as, for a small baby, we give 9 months, we give the first dose of measles vaccines. So, like there's another scientifically proven that mother's breast milk contains the measles antibodies. Like the beginning 9 months of life, The measles vaccine is not required for the baby because of the maternal antibodies. Maternal antibodies, the mother's milk has so much of beautiful power. It has something known as immunoglobulin A. It has some important factors which prevents the baby from malaria. So the important antibodies which the mother breast milk has, number one is the measles, that one basic infection as we know about. That is why we don't give measles vaccine to a newborn. We give measles vaccine after 9 months of life, because beginning 9 months of life, the mother's breast milk has all the appropriate antibodies which would require to fight for the measles infection. Then there is something known as immunoglobulin A in our body for the baby, basically for the recovery, for the growth and brain development also. And there's some another important immunity factor known as PABA, para amino benzoic acid. Like if I tell you as a layman, like there are some 100 and 200 factors present in the breast milk which prevents the baby from malaria, which prevents the baby from, which helps the baby in the brain and eye development. So every single thing in the breast milk which is there, the beginning 9 months of life, it has some amazing antibodies which are helpful for the baby, and accordingly, we give the vaccines and everything. That's what.
Okay, doctor. So, can you tell us something about the development of child's immunity in the context of COVID-19 pandemic?
Yeah, as in yeah, see, COVID-19, now this has been another journey for all of us. Like in the beginning, the vaccines came, after 6 to 8 months, and then we all got vaccinated. Then we got the booster dose, then we got this COVID shield, co-vaccine. Lot of transitions are there. So as far as the and we have recently, like 18 years plus also, we all can get vaccinated. So there are a lot of actually updated articles are going on regarding the if I talk about the pediatrics related COVID immunization. Because what is pediatrics? The beginning 0 to 18 years of life is what we say in a pediatrics period. So first we are covering the main adult generation, then we are covering our family, our grandparents. That era we have already covered. But as far as the 1 year old or 3 years old or 5 years old is concerned regarding the COVID vaccination, there are still updates, and the articles are going on. So right now we can only say that we are very positive that we're gonna have some amazing vaccines for the baby. But right now saying that this is the vaccine for a small baby, no. The beginning few years of life, there's still trials, and things are going on, updates, and we'll get it soon. So let's see how it goes.
Okay, Dr. Bhatia. So, can you tell us something about the relation between breastfeeding and child growth?
As far as the breastfeeding and the child's growth and development is concerned, the first question we always have is that for how long the mother should breastfeed her child, that how long she should breastfeed her, it will be good for her baby brain and eye development and the body development. The answer is 6 months of life, mother should exclusive breastfeeding. But over here, one very important point is that after 6 months of life, mother think about my feed is not required. Doctor had told me beginning 6 months of life you have to breastfeed, then we start the baby on the other feed. So that's a wrong answer. Beginning 6 months of life, we'll give only and only mother's feeding. But from 6 months of life till 2 years, definitely breastfeeding is compulsory, is mandatory. And also at the same time, like with the breastfeeding, we need to start the complementary feeding. As in, most importantly, you can say you can boil a potato and give a smashed potato to the baby. You can give a porridge or a dalia or a khichdi, something like that. But this, like the take home message we have it over here is that after 6 months, mother thinks that my job is done, Baba. I have done 6 months of proper feeding. Now we'll start the baby on the complementary feeding. But that's a wrong thing. After 6 months of life, your feeding is equally very much important. With your feeding, you should start the baby on the complementary feeding, because the baby needs other micronutrients also. So definitely the breastfeeding plays a huge role, because we have lost, there was a recent data also, there are so many lakhs of babies are dying in India because of lack of breastfeeding. Even we were having this recent, we were studying in our government setups, that even the mother having, it's a message for all of the people, all the beautiful generation, even the mother having COVID positive also, if the mother is TB positive also, and in some cases the mother is active HIV positive also, she must breastfeed the child. There is no absolute contraindication. If the mother, this is again another big scenario, big blunder we all do. No, no, mother is COVID positive, no feeding will be given. Mother is if the mother is fever positive, typhoid positive, dengue positive, COVID positive, TB positive, even HIV positive also, of course she must take the prophylaxis. Of course she must take the medications and treatments. But Breastfeeding is not contraindicated. She must breastfeed. Even a COVID positive mother also, she can have the mask and she have the basic universal precautions, and she must breastfeed the child because that is utmost important for the baby's brain and the whole baby's development. We have seen, because the so mother will ask that, doctor, what problem my baby will have if I don't breastfeed or delay the breastfeeding? The baby will have growth retardation. The baby will have short stature. We have seen cases with the baby not gaining weight and not gaining height. The baby even can have hypertension also. So all this basically growth retardation, mental retardation, hypertension, developmental delays, and indirectly, of course, the whole the baby's growth will be compromised. So these are the some important facts which you must share with the rest of the planet.
Thank you so much, Dr. Anand Bhatia. Thank you for coming to our show and sharing your valuable time and insights with us at Medicircle. It has been a pleasure having you on the show.
Thank you so much, ma'am. And again, I would like to thank every single person of the whole team who have approached me and who have, shared their beautiful views. That you have a genuine interest in sharing good knowledge to the whole planet, and to all the people who are gonna watch this show. Also, I can only give up one beautiful take-home message that number one, breastfeeding is beautifully very important. Please, consult your nearest physician, nearest gynecologist, or a nearest local clinic where you can understand the benefits of breastfeeding or how to breastfeed also. We have seen mothers not able to breastfeed properly. Maybe she's a primary gravida. Maybe you are pregnant for the first time. You don't know how to breastfeed the baby. Maybe you don't have grandparents at home. Maybe you have a twin delivery. There are some basic scenarios, frankly speaking, which can be very beautifully overcome if you have someone who can take care of you. So a nearest nurse or a nearest doctor or a pediatrician are always there. You learn from them how to breastfeed a child. How should I feel that my breast, what should I feel after feeding my breast? Because we always tell the mother that if your breast should feel little empty after a 20 minutes feed. Even a basic dictum also, there was one mother yesterday, she came, she was saying, the doctor, after every 5 minutes feed my baby sleeps off, and but after half an hour he's crying again. So again, I was like, you tell me again, what problem are you facing? She's like, the baby is feeding well, but problem ye hai ki every 5 minutes he take the feed and sleeps off. According to mother, is the very normal thing. The baby sleeps after 5 minutes of feed, but as a pediatrician now, it is our duty to tell that one breastfeed cycle should go for 15 to 20 minutes, and the second breastfeed cycle should go another for 15 to 20 minutes. So that's what, as a pediatrician, has a huge role to play. Will tell the mother, because when the baby is sleeping within 5 minutes, that is something known as foremilk. There's some very basic MBBS words known as foremilk and hindmilk. So in a simple language, we tell the mother that your baby will sleep within 5 minutes of the feeding, but that is not good for the baby because the whole fat content is there in the end part of the breast milk, and total breast milk cycle is for 20 minutes. So you rub the baby's ear, you tickle the baby's soul, little make him wake up. We always say in Hindi, कि बच्चा माँ के पेट से सीख के नहीं आता. We always say that a mother doesn't come automatically learning from the womb, right? You have to make him teach. You have to make him understand that my dear, this 5 minutes feed is not proper. You need to take a proper 20 minutes feeding cycle. And then she was giving a 20 minutes feed cycle. Baby sleeps beautifully for 3 hours, because after a good feed, a baby should sleep for 2 to 3 hours. Mother, she can rest her lower back, she can do this and that, she can have a nap or something, and then everything is sorted out. So otherwise every half an hour she is feeding. How frustrated it's for a mother to feed for every half an hour for 6 months. She'll go mad. She'll be like, please give me some cows or buffalo or some dabbe wala milk. I can't feed every half an hour, it's impossible. And once she do this 20 minutes quick cycle, baby sleeps for 3 hours, she takes a nap, her lower back pain is okay, and we can have a better future growth of our children, I guess. So thank you so much, ma'am.
Thank you for sharing such valuable information, and I'm sure it will definitely help our viewers gain some knowledge about this.
Yes, ma'am. Yes, thank you so much. Thank you
Thank you
so
so
much.
much.